And we're back. And if you're joining us right now, we're getting our first conversation for this morning started. And before the break, as we said, we were going to be getting a perspective on children with COVID-19. And joining us in our studio for this morning's conversation, we have Dr. Maxsuel Xiloj, who is the acting head of the Pediatric Unit at the Carl Heschner Memorial Hospital. Good morning.
Good morning, guys. It's a pleasure being here. Thank you for the invitation. Kind of nervous, though.
Don't be.
Well, just think of us as some of your patients. You're just explaining it to us in the simplest forms.
Exactly. And of course, Doctor, we're glad to have you here. And this is a topic that a lot of our viewers are definitely interested in, especially in the face of the reopening of schools. And a lot of parents are concerned about their children catching COVID and how to deal with it and stuff like that. But before we jump right into the topic, let's get a little bit of an introduction and can talk about your practice and how long you've been with the KHMH.
Well, I started studying med school in 2008. I spent 11 years in Guatemala, where I did my bachelor's in medicine, then continued to do my master's in pediatrics. I concluded in January 2019, and in August 2019, I began working at KHMH, and up to now.
Yeah. And how did, and you know, you were only working at the KHMH a few months into and then the pandemic set in. How did that initially affect your practice and the pediatrics unit at KHMH?
In the beginning, it was, if you want to look at it in a positive way, it was good because we barely had cases of kids getting sick. Our ward was quite empty. Yeah. We were accustomed to having a lot of admissions, diarrheas, fevers, respiratory cases of any type of virus, be it bacteria, virus, anything. But when the pandemic hit, our numbers went down badly. Yeah. But recently, 3 months into, since October till now, our cases we have had more patients admitted because of respiratory symptoms. Yeah. Not only due to COVID, but we have had more cases.
Yeah, they've had there was a bad flu going around as well. Let me ask you very quickly, when would you say, because what we're seeing with the Omicron variant is that children are being affected more so than with the past variants. When did you start to see the increase in children? Was it in January or December? When was it?
It was December.
Yeah.
December. Late November, December is where we started noticing more patients coming in, more patients admitted at the COVID PUI unit at KHMH. Okay. Or roughly 5 to 8 patients per shift. Okay. Used to come in for evaluation with fever, respiratory symptoms, gastrointestinal symptoms. It was when we were...
Now, Doc, you know, a lot of parents right now are watching and their anxiety is probably building at the thought of children being hospitalized for COVID-19. How would you assess the severity of the children that you are seeing that are hospitalized?
Okay, so first we have to understand that when it comes to COVID, most of our children will have mild symptoms, most of them. Mm-hmm. It will be a really low percentage of patients that will present complications due to COVID. Mortality rate in COVID is less than 1%, around 0.1% worldwide. So if you compare children to adults, it's a very, very small number. Mm-hmm. So since most patients will have mild symptoms, it varies from fever, cough, sore throat, some stomach pain, some can have diarrhea, some can have headache. Mm-hmm. And those symptoms can be treated at home. Mm-hmm. So if you, most of the time when parents seek our help, we tell them those are symptoms and we treat them. It's only symptomatic treatment. You don't need...
So you treat the sore throat.
Exactly, the fever, the abdominal pain, or the diarrhea. Mm-hmm. Those are the things we treat at home. Unless you have other symptoms, like if into the development of symptoms. You have a rash, bloodshot eyes, you have vomiting, you have headache, dizziness, which could be symptoms of low blood pressure associated to heavy breathing or trouble breathing. If you have any signs that your skin is mottled and you call it bad perfusion in your system, then you need to seek.
What does that mean, bad perfusion?
That means that, for example, you see your normal skin is pink, right? And when you have any type of infection that will affect your system on a whole, it becomes bluish or mottled.
Okay.
All right, and then the perfusion or the blood that goes to your extremities is less. And when you have severe COVID, that happens. When you see your skin, it starts getting pale. You don't have pulses, and those are things you can see. Or another thing I tell parents is, if they have the possibility, you buy a pulse oximeter, and that will tell you indirectly how your body is responding. So it tells you how your heart rate is, how your saturation is. So if you have those tools at home, a thermometer at home, you can monitor. You can be your own nurse or your own doctor at home, all right?
So we covered quite a bit there. Let's just go back very quickly to look at the symptoms that you're looking for in your children. Some parents are on the fence with decisions about school. They're worried about their children getting sick, like every parent who cares for their child. And traditionally, what we knew of COVID in the past is you're looking for loss of taste, loss of smell. But with this variant, it's different.
Yes.
Tell us about some of the early symptoms that have been detected for Omicron in children.
These symptoms are really unspecific.
Okay.
Because most of the symptoms are runny nose, a cough and cold, sore throat, diarrhea, muscle pain. And all of these symptoms can happen in other diseases.
Okay.
So one message I want to get out there is that it's not because your kid has a cough, cold, and sore throat that will be equal to COVID. All right, but those are the symptoms that children have right now. It's not the loss of taste, but basically any flu-like symptoms that you can have right now that Omicron can have that present with that.
And from the children who do get hospitalized, do they have other underlying illnesses, and what causes them to reach the point of hospitalization?
Okay, so the children that do get hospitalized are basically children that, apart from those symptoms, have difficulty breathing. Most of them reach at the hospital with tachypnea, which is rapid breathing. We have abdominal breathing. We have, when we put the pulse ox, the saturation is low, below 94. And when you do an X-ray, you notice that the patient has a pneumonia, or patients that complain that they have vomiting and diarrhea. And parents have tried, they give Pediatric at home, they tried to see if they can tolerate fluids, and then when they notice the baby cannot tolerate, that's when they go, and that's when we decide to admit patients.
Yeah, mostly for what? Dehydration?
Dehydration, yes.
Yeah. And what's the age range that you're seeing in the hospital?
The most, the number I would say between 1 month and 5 years. Those are the patients that have been reaching more. We've had patients that are older than 5 years old, but the numbers at that age above 5 are low.
And how long do they require hospitalization?
It depends. It depends on how their body responds to the treatment. Some can take 2 days, some can even take a week or 2. It depends on how severe their symptoms were and how easy their body recover from whatever brought them to the hospital.
And what are some of the, especially because, if you're seeing infections in very young children and babies, what are some of those first telltale signs that you can see? Because of course, the babies, they can't tell you, I have a sore throat or whatever. So what are parents, or what are some of the first ways that parents can look out to see that maybe something might be wrong?
Okay, so most of them, since like you said, they won't tell you what they have, but You will normally see a kid that plays with your toys every day, they're up and down. Then all of a sudden they had a slight fever 2 days ago. Then later on you notice that they're not playing anymore. They're not their selves. Some of them are even fuzzy. They're too fuzzy, and you try giving them food, you try feeding them, you try playing with them, try going with them, but then still fuzzy. And you're trying to find a reason. They're not telling you what is causing them to be fuzzy, but most of the time it's because something is going on in their bodies. They cannot tell you what is it. So most of the times it will be fuzziness. Their activities will decrease. They will be, we call that, more hypoactive, more in a tendency until they want to sleep, they don't want to eat. Yeah.
And going back to the symptoms that children are having, around the world, they were talking about increased hospitalization of children. And we've been reporting the same thing here. But one of the things I know you've been very clear about is that they are hospitalized, but they're getting treatment and being released. I imagine, Doc, that means that a lot of parents get worried and bring their children to the hospital.
Yes.
Is that what's happening?
Yes. Unfortunately, that has been happening for the past month, where our emergency is filled with a lot of children, but most of them do not require admission. And unfortunately, we're short-staffed. So let's say we have 10 to 15 kids on a shift, night shift, and we only have 2-3 doctors that also have 20 other patients on their hands, and we have little amount of nurses. So by the time they reach to children or patient number 15, the parents are mad because the attention is not what they want, they expected, but it's not because they didn't want to treat them. It's because they have a lot of other patients to tend to. So most of these patients do not require emergency care.
Yeah.
So what I recommend to parents is that at home, if you have Tylenol at home, make sure you know what dose you can give them. If you things to have at home, Pediatric to hydrate your patient, medication for pain, ibuprofen, and only the fact that your baby has fever is not equal to I need to run to emergency. That doesn't mean that if your patient has fever, you're relaxed at home.
Yeah.
But you can monitor it at home. What you can do at home is, when the baby has fever, you can bathe them, give them their fever medicine or cough medicine if they need medication for cough, or if they need to be hydrated, give them hydrating salts like Pedialyte.
And in small doses.
It's small doses.
Yeah.
But one thing I've been stressing lately is for parents not to panic. And most of the time when we tell them the diagnosis, all right, your baby has the COVID, they start to panic. Something bad will happen. We've seen and we know that our patients, it will be a low percentage that will do present complications. So it's not it's something bad if you get COVID, but it doesn't mean something bad will happen. So just keep calm at home. Just be yourself at home, because if you start crying and the baby doesn't even know he has COVID, and you as a parent are crying, they will panic too. So you don't want kids to be frightened. Treat them as a normal day. Just give them their medication, tell them that will help them, and continue on with their regular day.
If the child, which children would you say you want to monitor closely? Like if they have asthma or other, maybe they're a juvenile diabetic, are these ones that maybe you want to keep an extra close eye on?
There are patients that are considered patients at risk of developing complications, and all of them have underlying disease. Most of these diseases mean that their immune system is weak. All right, for example, patients with HIV, patients with diabetes, patients with lupus, patients that have underlying diseases that their immune system are not working as well as our one, and that have heart problems, that have asthma. These are the patients that we need to be on the lookout for. So if you have a relative at home, it doesn't only go for children, even for adults. If you are sick and you have a relative, your grandpa, your grandma, your little son, your nephew, if you have patients that have underlying diseases, you have to isolate yourself from them, because even though you're 3 years old or you're 5 years old or 10 years old, you won't have moderate or severe symptoms. But if you go close to these patients, they can have complications.
Yeah.
So these are the patients that you need to try keep away from, or us as pediatricians, if they have COVID, those are the ones that we have to always have close monitoring.
Yeah. So that's key information for parents.
Yeah, for sure. And for have you found that speaking of preventative measures, have you found that parents who have children who are old enough, have they been receptive to getting their children vaccinated? Or there's still lots of questions about that?
I think that it's not only here in Belize, everywhere in the world, they're asking questions about the vaccination. Unfortunately here, and like most part of the world, kids are not eligible for vaccination as yet.
Yeah.
All right, so one thing I recommend is not only COVID vaccination. We have other diseases lately, flu, for example. Yeah. That's a vaccine that most parents, I don't know why, but they don't like to give to their kids. Then now we've seen more patients with flu-like symptoms. So you could even say it's influenza. All right, and one of the key points here is that they're not vaccinated. We have Pertussis, which is a whooping cough. Those are diseases that are respiratory diseases, and parents are not vaccinating. Most of the excuses we've heard is because they're afraid to go to the clinics because it's saturated with respiratory cases. But that does not mean, and that has been a problem with the pandemic. Most kids' vaccinations are not updated because of because
parents don't want to expose them.
Yeah, but I do recommend if you can go to your private clinic, or schedule a day where there are not a lot of people. Just monitor where you can go, where you can't go. Yeah. But please update your kids' vaccination card.
That's a key point that you're bringing out there that perhaps can be planned for. I know that respiratory cases go to the public clinics, but so do pregnant moms and new moms with their babies for vaccination.
Exactly.
So maybe they can designate times or days specifically for vaccination
that
for
would
children.
Be good, yes.
But going back to it, when you mentioned the situation of the emergency room with 15 children plus other patients, triaging is hard. Prioritizing who gets care first in an emergency room, it's always a challenge. And in KHMH, it's no different. But I always use the example that there's what you see in the emergency room, but for that family, that child is the biggest emergency in their family. Mm-hmm. What's your advice to parents as to when to know if they actually need to go to the emergency room, or if they can do treatment at home and maybe go for a scheduled visit after?
Okay, so let's start with the symptoms that don't require you to go to the emergency.
Okay.
Fever, low-grade fever.
What's low grade? Give us numbers,
I would say a little bit around 100 degrees Fahrenheit, 101, 102. Mm-hmm. Those this is something you can treat at home. That's always have Tylenol at home, and you have to be prepared. Mm-hmm. Most parents don't have anything at home. That's why they go to the emergency. Mm-hmm. Oh, I don't have Tylenol, so I'm coming here 3 o'clock in the morning for you to treat my fever. But then you don't know that you have other patients waiting online. Yeah. So fever. If your baby has a sore throat, that can be treated at home. If your baby has cough, cold symptoms, that can be treated at home. If your baby has diarrhea, that can be treated at home up to a certain extent. If your baby has signs of dehydration, for example, babies that cry, all right, you say when they cry and they produce tears, that contains water. So all of a sudden, if your baby starts crying, obviously it have 10, 15 times diarrhea per day. And all of a sudden when they start crying, no more tears, their lips are dry. Some have, for the little ones, the infants, the fontanelle. And if it's depressed, those
are mole, what they call the mole.
Exactly. Yeah. If that's depressed, your baby is crying without tears. Your baby has the lips dry. there's something called turgidity in the skin, whereby we hold our skin like this, and if you notice, it goes back to normal. And that's because we have a lot of water in our body, and that goes back. But in dehydrated kids, if you do this, this takes long to go back to normal. So those are signs you have to look out. All right, my baby is dehydrated. I need to go to the hospital. But if your baby has diarrhea, give them Tylenol. Avoid spicy foods. Avoid Gatorade. Avoid any type of juice that you can buy at any supermarket.
No sugar.
No sugar foods, exactly. So those are things that you can care for at home.
And
now,
even dosing the Pedialyte is important, right?
Yes.
Yeah.
Yeah, well, all the time your baby has diarrhea, you can give them from 10 to 15 mLs of Pedialyte every time they have diarrhea. Now, if they want to drink more, give them, if they want to drink more than 1 liter, you can give them. If they're thirsty, that means they need more fluid in their body. All right? Apart from these symptoms, there are other symptoms that will appear, and that's when you need to go to the hospital. So if you have, apart from those symptoms, we have a generalized rash. If your baby has
just like pink small dots all over?
Yes.
Okay.
Dizziness. If your baby has difficulty breathing. If your baby has, you already treated the fever, you have 2-3 days of giving them Tylenol, but they're not improving, go to the hospital. If your baby has vomiting and they're not taking any fluids, none at all, go to the hospital. All right? Because that means that something else can be happening that you as a parent cannot treat at home.
Yeah. Very key, very important information. So, if I do my child gets diagnosed with COVID-19, right? The family's been exposed, maybe they test them and they confirm it, or the assumption is I'll have to care for them, so if I have it, they'll get it. These are the type of medications that I want to keep at home and how I would treat, right?
Yes.
Okay.
Always bear in mind that most children won't, that's the key here, they won't get complicated. So don't panic. Just have your medications at home and be prepared. Obviously, you'll have to ask a doctor or a physician or pediatrician what's the dose you're going to give them, so that when the fever strikes, you can know how much to give them. Because we can have cases where you give them too much of Tylenol and you can cause intoxication. So you don't want to run the risk aside. You want to be your own doctor, and you will, if you only require 5 ml, you give your baby 20 mLs every 6 hours. You can have some complications acutely, so you don't want that.
Yeah. And it's also, when you think about it, when we know that COVID can be serious for some people, and when people have a child that's unvaccinated, they're worried about severe forms of severe complications. So when I see a fever, I'm like, okay, I want to take my child to the hospital because I want them to get treated. How many days should I wait if my child has a fever? Let's say they're at 102 and they have a fever today, I'm treating with Tylenol, and tomorrow I wake up, they still have the fever.
I would wait and recommend them at least 3 days. All right, 3 days of monitoring. Apart from the fever, you need to look out for other symptoms, right?
Yes.
But if it's only fever, I would wait up to 3 days. You're giving the dosage varies. Some of us give a low dose of Tylenol. For example, the dosage for Tylenol will be from 10 milligrams per kilogram to 50 milligrams per kilogram. So some start at the low dosage, 10 milligrams per kilogram. And sometimes, that is enough. That's all right. At day 2, the fever is still ongoing. He or she is still eating. They have no other symptoms. All right, I call my doc. Doc, what I could do? Increase it to 15 milligrams per kilogram. You increased it. At day 3, the baby continues having fever. But at day 3, you start noticing that the baby started with vomiting and diarrhea.
Yeah.
All right. Now I need to go to it doesn't mean you have to go to emergency, because there are other peripheral clinics like Cleopatra White and Mitran Roberts. You can take them there.
Yeah.
It doesn't mean you have to rush to emergency, but you need to seek medical attention.
You seem to say don't rush to the emergency. You've been seeing that a lot. Tell
Yes.
us about what's happening.
Yeah, we've seen with the doctors at the COVID unit, I think we're overwhelmed with work because it's too much. Many kids go in just for fever, and most of the time, parents are worried, and I understand at the point of their point of view. I'm worried because of my baby is sick. But you have to understand, if your baby has mild symptoms, it's not that we don't care, but we have other patients to care for that have severe symptoms. We have patients that are intubated. There have patients that have
Adults.
Adults, high flow nasal cannula. Not even adults, even kids. We have patients that can be there because they have a pneumonia, and we need to treat that pneumonia, and they call us because that patient is getting complicated. So our attention will go towards that patient that is complicated. We won't center our attention on a baby that has just fever or just diarrhea and is hydrated. So these are things that we take into consideration. If your baby just have fever, we will send you home. Obviously, we'll talk to you and tell you to look out for alarms and then alarming signs, and then we send you home.
Yeah.
And has there also been an effect on, because of COVID and having to treat all the COVID patients, is there also been, are we seeing as cases of other pediatric cases of other diseases, like, that of concern right now that, that perhaps that, children have traditionally been so vulnerable to?
Yeah, like I said, influenza. Influenza is also out there, so we have had cases where patients come with flu-like. It looks like COVID, but it's not COVID. Flu-like symptoms. We have patients with pneumonias, bacterial pneumonias, or other type of viral pneumonias. We have had patients that come in because of acute gastroenteritis, only gastroenteritis, just diarrhea, 10, 15, and dehydration. It's not due to COVID, but we also see them. Now, they're associated to viral diseases, so that's why most of them go to a COVID unit or PUI unit, because we need to isolate them until we have a negative PCR. Then we can say, all right, this wasn't due to COVID. We send you to the regular pediatric ward, or if you're healed already, you're better, we send you home.
Yeah. But isn't that a risk for exposure, though? I mean, because you go to the hospital and you don't know if it's COVID. You have to wait for the test. You may get exposed.
Well, no. Well, yes and no.
Okay.
Obviously, you're exposed because you don't know who else is at the hospital. But all the doctors there, they have their mask on or their shields on. The ones that need to go into a room with a COVID patient, they're dressed with their full PPEs. And most of our pediatric cases are isolated from the adults. Well, not most, all of them are isolated from the adults, and some even have isolation rooms for just one patient. So we're done. We're not. That doesn't mean that if you have respiratory symptoms, you will go in a COVID unit where you can get exposed.
I think it was in 2020 there was the first pediatric death, and there were protocols put in place to kind of, as a result of that case, to allow for parents to have access to the children. That's still the case?
Yes, we are allowing one parent per child, and they also need, when they go in, we also explain to them that if you're going to be inside, you have to wear your mask, because you will get exposed. Obviously, that doesn't mean that everybody is out without mask, but you don't know. Something can happen. If you have 10-15 minutes without your mask and someone comes in with a cough or distress, and you're inside there, everybody's, you're getting contaminated. So we tell parents, always wear a mask, always don't mingle with other patients, don't, and that's something they do. Say, your baby looks cute, but I go hug your baby. No, don't do that. Just stay on your side with your baby and don't mingle with other patients.
And have you found, since the beginning of the pandemic, that has there been a difference in the reactions that you're seeing in children based on the different strains, or has it more or less been consistent since the beginning?
It has been consistent for us in pediatrics, because we were accustomed of having patients with diarrhea, with respiratory. That is one of these are the most common diseases that we see on a daily basis. If you go to any private institution, Our babies go because they have a flu, they have diarrhea, they have fever. So it's something we are accustomed to. So it doesn't change that much. Unlike adults, we're different, very different, and adults
because
have the tendency to have more complicated cases.
And when we were experiencing our Delta wave, of course, there were a lot of severe cases among adults. And now that it seems that Omicron is being the more dominant variant, we're seeing more infections, but less severe cases.
Yeah.
But I'm gathering from what you're saying that in the pediatric cases, it's more or less been similar, where most children are not going to get severe cases.
Yes, but that doesn't mean that, all right, they just have flu-like symptoms.
Don't pay attention.
Don't pay attention, and let's expose your kids. And one thing I saw for Christmas and New Year's, and everybody was going out with their kids. They went shopping. They went to the markets, and you saw a lot of kids. And yes, the symptoms always are mild, or most of the time they're mild. But you don't know who will get the severe. You don't know. So what you don't want to risk is expose and say, all right, I will run my chances and I go in a market with my kid. Yeah. And what if this one is the 0.1% that get complicated? Yeah. So you don't want to expose them.
That's the gamble that's always taken. There's naturally vulnerable people, and then there's just some who have poor luck.
Exactly.
Who develop the severe complications of COVID. Let me just go back to the COVID unit and the pediatric accommodations for children. How many children are you treating at this time, or what's the maximum that you can treat?
It varies.
Okay.
It varies because we have days where no pediatric cases go.
Okay.
And we have cases where we have between 15 to 20 kids entering at the COVID pediatric unit. Where they need to get evaluated, because obviously if you reach there and you want attention, we will give you attention.
So not 15 to 20, not necessarily
admitted,
needing admission,
exactly,
but brought in because the parents are concerned.
Exactly.
Okay.
Yeah, and not all of them get admitted. I would say between 5 and 8 are admitted at the COVID unit, and sometimes it takes 3 to 5 days for them to get compensated. Yeah.
And looking at the demographics, is it more boys, more girls? You already said it's the under 5 that seem to be requiring more hospitalization. What about boys or girls? Any difference?
No, we haven't seen any difference between boys and girls, but I'd want to say it is more boys. Okay. All right, and boys like give trouble. They're more rough and.
Well, men, when they get sick, they will feel hurt. It starts young. I'm kidding.
But it's true.
All right, but Doc, let's be real here. There are parents watching, and I think the idea of your child in the hospital it's scary. And the idea of COVID affecting children leading to hospitalization will make, naturally, you become overly cautious and maybe take them to emergency when you don't really need to. What do you say to parents to manage these symptoms, whether or not they have confirmed or not confirmed their child has COVID?
I will tell them to always be prepared. Always have your medications at home. Always keep in contact with your physician. And don't panic. Basically, don't panic. Treat them with the symptoms, with symptoms like fever. Treat them at home with Tylenol, with ibuprofen. And if they have cough, have your cough syrup at home. Most of them, I remember when this pandemic started, we used to have combos. If you go to a clinic and you say you have COVID, they used to give you vitamin C, vitamin D. They used to give you azithromycin. They used to give you a bunch of stuff because we didn't know how to treat it on a whole. Up to date, there's still ongoing investigation on how to treat mild symptoms, but most of them are with adults or some, there's still ongoing investigation how to treat at home. All right, but you don't require a vast amount of medications to treat your baby at home. It's just basically your Tylenol and your Pedialyte or your cough syrup. Those are the basic things you need to, and if you have the opportunity, get an oximeter to monitor your baby or yourself at home.
And a thermometer.
And a thermometer, yes.
Yeah. And the temperature that I should definitely take them to the emergency room is what, 104?
I don't want you to after this conversation, Sarah, at 102, I'm safe. Do we have kids that even with a fever of 100.5, they have also signs of dehydration? That doesn't mean, all right, so my baby is dehydrated, but the fever is low. I'll keep him home. No, it depends. It depends on what other symptoms you have. But if you only have a fever of 100, 101, 102, and you're okay at home.
They're dehydrated, not vomiting.
Exactly.
No diarrhea,
You can stay at home, treated just with Tylenol and hydrating salts. And I always tell parents, even if you don't have any other symptoms, keep your baby hydrated. Continue feeding them as per usual. Maintain your baby hydrated so that you don't get decompensated, because most of the time when you have fever, you sweat and you lose fluids. So you always have to have an adequate intake of fluids. So it's not only just Tylenol, but also maintain your baby hydrated so that you don't run the chance that you might need admission.
Yeah. All right. Well, Doc, we appreciate you coming in. We know things are busy there at the KHMH, but of course this is information that a lot of parents need to know, especially as we continue to see the rapid spread of Omicron across the country.
Thank you for inviting me.
Thank you too, and stay safe.
All right.
And with that, we're going to go ahead and take a break. When we come back,
we're going to be getting an update from the new leadership of the BDF, and we're going to be also learning about BDF anniversary and BDF Day. So please stay tuned, and we'll be right back after the break.